And now I want to turn to the humanitarian crisis in Gaza, where chaos continues to swirl around newly opened distribution centers following months of an Israeli blockade. This new video highlights the desperation for these Palestinians clamoring for just basic food and supplies at this World Food Program warehouse. The UN saying it was broken into by, quote, hordes of hungry people before the blockade. Of course, others were able to get in and see this damage and the desperation in firsthand. Dr. Clayton Dalton among them. He's an emergency physician. He traveled into Gaza as part of the UN's medical aid team. His experiences were documented in a video diary and column for The New Yorker entitled Hospitals in Ruin. And Dr. Clayton Dalton is joining us now. Thank you so much for taking the time, Dr. Dalton. You described the devastation you saw in Gaza like nothing you've ever seen before. Given your background as an emergency physician, walk us through what that means for you.
It's great to be with you, Anna. Thank you. It's hard to describe. I mean, every aspect of the healthcare delivery system was touched by destruction in some way. It wasn't a question of whether or not components had been damaged or facilities had been damaged. It was just a matter of degree. Some of them were functional in the midst of the rubble. Some of them had been completely destroyed, absolutely beyond repair. Supplies were limited. Gauze was in short supply. Antibiotics were in short supply. Everything that you would need to take care of patients in this environment was in short supply. And this was during the ceasefire. So this was when medical aid was actually coming in, and still it wasn't enough. So I've been in touch with people that I worked alongside who are Palestinian healthcare workers who are still there, and they say that it's just so much worse, which is hard for me to imagine. I mean, this was already beyond anything that I'd ever seen before. The circumstances they're working in are just so difficult.
What brought you to Gaza? What inspired you to go there?
A sense of being able to make some contribution, to be able to support them medically, to be able to tell their story. That was actually the thing that people asked me to do when I was there. The healthcare workers I worked alongside, they were so glad to have us there just to help medically. But so many people, dozens of people said, please just tell the world about what is happening here. Tell them what you see. Tell them what's happening here. And that's what I've tried to do.
In your New Yorker video diary, there was a doctor who was giving you an inside tour of the damaged ICU who points out medical equipment that had appeared to have been systematically disabled with bullet holes. I want to play a portion of that.
He took me up into the ICU and showed me a number of different pieces of medical equipment, and all of them seemed to have a bullet hole in the screen.
The soldiers?
I don't. He was like, I don't understand. And I get that. I also was struggling to understand. This didn't seem like collateral damage to me. You know, these were specific pieces of medical equipment that seemed to have been systematically disabled.
The IDF denies that they specifically targeted medical equipment, but what was your takeaway from this?
This was horrible. I mean, I wasn't there when these machines were destroyed. I don't know exactly what happened. I can say that the implication that was shared with me by Dr. Moran Sultan, who you can see in the video, who's the director of the hospital, was that he discovered this damage after soldiers had been active in a hospital facility. And the IDF did deny that they destroy medical equipment in this way. But it was extremely disturbing. It's hard for me to understand any sort of justification for this kind of targeted destruction.
So much destruction and chaos that I know you witnessed firsthand, that we've seen in the images, but you also describe witnessing moments of normalcy, seeing a family congregate over tea, children laughing and playing, and even flying kites. I mean, these have to be incredibly dark times for them, and yet what resilience, what perseverance, what did you learn about the spirit of the people there? What do our viewers need to know?
It was extremely humbling. I saw this in the healthcare workers that I worked alongside and the civilians who were still trying to make a life in this place. They were kind, they were welcoming, they were generous. They would always be sure that we ate first, which made me extremely uncomfortable. But there was no negotiating that. And there's so many children. Nearly half the population of Gaza, which is about 2 million people, is children. And they're just finding a way to live as children in the rubble. They're finding ways to play and to laugh. It's what children do. I think it was so important to me to remember that, you know, we're exposed to these scenes of destruction, of famine, and it's so important that we stay aware and conscious of what's happening there. But we also have to remember that these are people just like us, and they're trying to live their lives here. I think we have to remember the humanity of the people who are here.
Dr. Clayton Dalton, thank you so much for sharing what you witnessed, sharing your reporting and firsthand accounts of what you saw. It's so important, and we really value your time today. Thank you.
Thank you, Anna. Good to be with you.